it is quite not a allergy or food sensitivity. It's a serious autoimmune condition where the immune system attacks the small intestine when you ingest anything that contains gluten, even very small amount, and leads to a lot of symptoms.
Hello, you're watching Proactive. Joining me is Immunic Chief Medical Officer, Dr. Andreas Mühler. Andreas, very good to speak with you. May is Celiac Disease Awareness Month. Why is it important to raise awareness and spread the word about this disease?
Yeah, thank you, Stephen, for having me again. And I'm very happy to talk about this topic. It's really something that's very close to my heart because celiac disease is a really important disease with significant consequences for patients, but it's often diagnosed with delay and it is also misdiagnosed. And the reason is that the initial symptoms are often very unspecific symptoms that could come from different diseases or conditions. And so it takes some time always to diagnose it the right way. Even so, I think we have very good tools now, immunological tools, screening tools, but that are often applied only with a little bit of delay. So I think it is very good to have the Celiac Awareness Month to talk about early detection and to really make sure that with these unspecific symptoms that we always think about celiac disease as one of the reasons why patients or why somebody could have this disease. And it is quite not a allergy or food sensitivity. It's a serious autoimmune condition where the immune system attacks the small intestine when you ingest anything that contains gluten, even very small amount, and leads to a lot of symptoms. And so I think, therefore, I think we need to raise the awareness, and I think this celiac disease awareness month is a good opportunity to make sure that we think more about these patients and also look for new ways to help these patients in treatment, but also in terms of, for example, providing more and better gluten-free options for these patients in the future.
Andreas, could you walk us through the signs and symptoms of the disease?
Yeah, absolutely. So, like I said, I think most of these symptoms are often unspecific, and you would say they happen to a lot of people, but basically you can think of diarrhea, bloating, fatigue, and so forth. But I think it's celiac disease is much more than these symptoms because it has really serious medical consequences to have this disease because it goes to basically that it leads to, for example, malnutrition. And malnutrition is often the reasons that, for example, we develop what's called anemia. You don't have enough red blood cells with hemoglobin, so that you don't get enough oxygens into your tissue, and also you don't get enough, for example, calcium into your body resorbed in order to have the right bone structure, for example, which is called osteopenia. But it also can lead to weight loss, failure to thrive in children, so growth retardation in children, because often the disease starts already in children. But it also has extraintestinal symptoms, so symptoms or diseases outside the gut. So you have certain um, changes in the skin. It can lead to infertility. It can lead to neurological or skeletal disorders. And I think this persistent damage to the architecture in the gut can also lead to malignancy risk in the small bowel. So this is all um, very serious medical consequences, often overlooked for celiac disease. But I think the main problem for patients also is day to day kind of the emotional and social impacts that the disease have in terms of you can't go out. You always have to think about where to eat and what to eat. You always have to be afraid when you eat outside your home, how this was prepared. Um, it's very well known that celiac disease also leads to social isolation for that reason because you can't participate in a social life like many other people do. And at the moment, unfortunately, the only way for these patients treat the disease or live with their disease is to follow a very strict gluten-free diet. And if you ask patients and they ask patient advocacy group, it's very clear. It's often even impossible to have a strict gluten-free diet because gluten is contained in so many products. It's impurities in things that are actually shouldn't contain um, gluten, for example, cosmetics, and it's often not labeled exactly for these impurities. So patients really have a hard time staying on the gluten-free diet, even if they want to, and follow all of the recommendations.
So if a gluten-free diet is the only option available for celiac disease patients at the moment, but you are trying to find a real new option, Andreas. Tell us more about Immunic's work in this field.
Yes, so we have a investigational drug that we're investigating in celiac disease that's called IMU-856. It has a very unique mechanism of action. It acts on what's called an epigenetic target that's called SIRT6. And SIRT6 um, has been shown now to be a master switch uh, for triggering the regeneration of your lining in the bowel architecture. So it basically provides more and new cells and more quality cells in your bowel lining, in your architecture. And this will not only restore your bowel wall architecture, but it also is good to improve the barrier function. Yes, because the gut has to uh, provide protection against, for example, the microbiome, all the bacteria that you have in your bowel, um, and provide a barrier against a lot of the immune system that is in the bowel wall. In that respect, by providing and supporting that bowel barrier function, it protects gut health also. So we had early clinical data in what's called a phase 1b trial with 43 celiac disease patients. And we found that IMU-856 really showed very good results in four different dimensions of the disease. Histology was basically looking at the bowel architecture, disease symptoms that I outlined earlier. We have also biomarkers for celiac disease that we looked at, and also, and this was um, really, I think, very surprising for us to see this in a very early trial with only 28 days of treatment. We had improvements in the absorption of micronutrients, very important micronutrients. And altogether, we think this is a very relevant, new, and novel mechanism of action for celiac disease, for patients with celiac disease. But it's not specific to celiac disease. There's um, these changes in bowel architecture and in the bowel barrier function apply to other gastrointestinal diseases as well. So we actually think that IMU-856 um, could provide a really new class of treatments for multiple chronic gastrointestinal diseases, much beyond celiac disease. But the initial data that we have so far are very promising data in celiac disease, and we hope to that this is something that could really provide an update in or a first therapy or some of the first therapies in terms of celiac disease.
Andreas, some of these findings were just presented at the recent DDW conference in San Diego. Could you walk us through the most meaningful clinical insights and what they might mean for potential future treatment approaches?
Absolutely, because we had two posters at DDW at this conference with new analyses for IMU-856 from our phase 1b trial in celiac disease patients. The first poster was about whether the architecture changes or the damage to the bowel architecture that these patients had when going into the trial um, were driving the outcome of the trial. So it looks at patients that have a severe damage already when they come into the trial, and that this trial was actually a gluten challenge trial. So it basically um, provides the antigen to these patients in this trial, and the trial was um, had the objectives to show that we can prevent against further damage. And there's always the question whether, if you already have existing damage, whether this will prevent the drug to act in the same way as with patients that have a relatively intact architecture. And we could show in this analysis that we provided in this poster that really even the patients who have already severe damage can benefit from the drug. And actually, some of the patients that have severe damage actually benefit and improve in their architecture, even so this is a gluten challenge trial. So that these are very good subgroup analyses that we did from this trial. The second poster was about what's called pharmacokinetics, so how the drug is taken up when taken orally. So IMU-856 is a once daily oral administration medication, which means it has to be taken up in the bowel to get into the bloodstream to act. And of course, if you have a severe damage of the bowel because of celiac disease, it may get more difficult for the drug to get into the bloodstream. But we could show that these patients who had a severe damage already because of the celiac disease in the bowel architecture still have the same efficacy or the same way of taking up the drug into the bloodstream. So the damage by the celiac disease is not interfering with the uptake of the drug, which also is good because we want to make sure that all patients have good access to the drug after taking, for example, a tablet by mouth.
Any other key takeaways from the conference that stood out to you worth highlighting?
Yes, I think, of course, any Congress that deals with the gastrointestinal system, of course, discusses now the GLP-1, especially peptides that are available. This is kind of the latest drugs, of course, that everybody probably has heard about in terms of either diabetes and/or weight loss, and has very well transformed the treatment of these two diseases. We had shown for IMU-856, for our drug, that it has an effect also on GLP-1 level. So it increases the GLP-1 serum level or blood levels when you give this drug, very likely through inducing more production of GLP-1 by these cells, by these very specialized cells that produce it in the gut. And of course, with all of the drugs available on GLP-1 and also GLP-2 drug peptides now, peptide mimetics now, there's a lot of new information how actually these enteric or bowel hormones, GLP-1, GLP-2, these are bowel hormones, actually help to improve also gastrointestinal diseases like inflammatory bowel disease, for example, Crohn's disease or ulcerative colitis, other bowel diseases as well. So there's more breadth now of their use in gastrointestinal diseases. And since our drug also has some of the effects on GLP-1 and presumably probably on other or potentially also on other of these gut hormones, I think it was very important for us to really look at the data that we have from these peptide mimetics and what it means also for the future development of IMU-856. And I think that's something that we're actively monitoring because it will also help us to guide what we should do in terms of future development for IMU-856 for our drug.
Andreas, I hope you'll keep us updated on progress with IMU-856 and celiac disease. Thank you very much for your insights today.
All right. Thank you, Stephen. Good to talk to you.
And to you, Dr. Andreas Müller. He's the Chief Medical Officer at Immunic.